Welcome, everybody. Thank you for joining our timely discussion on enhancing community resilience equity. I'm Rhonda Binda, the Deputy Queensborough President in New York City, and I will be moderating for this interactive conversation today. Our talk is part of a series, and this is part 2 of DHS's Whole of Government R&D showcase on enhancing resilience and innovation equity. Let me share some context before we get started. Our conversation today will address the important role research plays in helping communities prepare, respond, recover, and adapt to threats of human-induced or natural disasters. Understanding and reducing risk, both before and after disasters occur, can increase resilience and help communities evolve and thrive. In the face of compounding pressures, we know so many of you are looking for new ideas and tangible solutions. Our talk is designed so that you can come away with a deeper understanding of what U.S. governmental researchers are doing to ensure no community is left behind. With a focus on delivering transferable solutions, each of our presenters is focused on making societal impacts to reduce disparities and build equity. So let's get going. I'll now introduce our panel. Dr. David Alexander is the Director of Research and Partnerships at the Department of Homeland Security Science and Technology Directorate. Dr. David Corman is the Program Director, Cyber Physical Systems and Smart and Connected Communities at the National Science Foundation. Dr. Eric Svendenson, the Director of Division of Environmental Health Science and Practice, Centers for Disease Control and Prevention, National Center for Environmental Health. Dr. Jeff Payne, Director, Office of Coastal Management, National Oceanic and Atmospheric Administration. And Dr. Andy Miller, Associate Director for Climate, Air, and Energy Research, Office of Research and Development at the U.S. Environmental Protection Agency. So we'll get started with our questions now. When we talk about the pandemic, floods, wildfires, and widespread power failures, I'd like to discuss what are those key factors or variables that can make or break a community to get to why resilience really matters. I'd like to start with Dr. David Alexander. Knowing there are different kinds of persistent and chronic events, what is your starting point when investing in science and technology to drive down risk and ensure no community is left behind? Please help us understand why resiliency matters.
Great, thank you, Rhonda. So for DHS, resilience is about more than just withstanding disasters and disruptions. It is also about adapting, evolving, and bouncing forward as individuals, civic organizations, and communities. Disaster risk affect us all and impact every aspect of the nation. We know we can't respond our way out of disasters, yet disasters in some form are inevitable. While we can't prevent all disasters, we can be disaster ready, which is in many ways a function of resilience. For us, disaster resilience has to happen at the community level, not just the national level. That means there's no one-size-fits-all solution to resilience, and we have to be pragmatic in the R&D we pursue and the collaborations we cultivate to ensure no community is left behind. It is vitally important for us at DHS and the larger scientific community to better understand disaster resilience and risk and their interactions with societal dimensions. Factors such as public safety and security, economic stability and resilience, health and well-being, community identity and social connectedness, trust in science and government, and global risks such as climate change. Exploring solutions and advancing science and technology towards strengthening the resilience of cross-cutting enablers within communities, such as education, employment, infrastructure, institutions, and systems. Solutions have to be translational and community-driven, encourage diversity and inclusion in the marketplace of ideas, and ensure that all benefit from our R&D investments and we are producing outcomes for everyone. Resilient, smart, and connected communities, from our perspective, mean a stronger homeland. A stronger homeland fosters a stronger DHS and a more vibrant nation. So back to you, Rhonda.
Thank you very much. That was a great answer. The planet is warming. Researchers acknowledge this is fueling more powerful storms, placing increased demand on communities. How does the climate crisis impact public health, and how is it changing the ways people live, including impacts to Indigenous communities? And I'd love, Eric, if you can help us with first answering this question. Thank you.
Sure, thank you. Well, climate change is already impacting human health, and the science indicates that this is expected to increase. The impacts of climate change on human health include heat-related illness and death due to extreme heat, deaths and injuries resulting from extreme weather events, increased respiratory and cardiovascular disease, changes in the prevalence and geographic distribution of food and waterborne illnesses, and other infectious diseases, and even threats to mental health. The human health impact of climate change is an emerging scientific field, and we're still exploring the extent to which current health impacts will change, the rate of emergence of novel health impacts, and the impacts on the populations which are most affected. CDC works to enhance the science base and build capacity at the state and local levels by providing direct technical support and a framework for protecting human health. There are challenges in fully understanding the relationship between climate change and health. One of the challenges is that climate and health data are not collected at consistent geographic and temporal scales. For example, temperature and precipitation data are often on a grid scale, such as a 5 by 5 kilometer grid. However, health data is often on a county or census tract level. So CDC has begun to address this gap by transforming some of the climatologic and meteorologic variables so that they can be directly paired with health data on those same geographic scales, but many gaps remain. While there has been some work on individual climate and health indicators, there still is no national climate and health indicator system. So we know that climate change influences human health and disease in numerous ways. Some existing health threats will intensify, and it's likely that new health threats will emerge. We know that not all people are at the same risk of negative health impacts. That's the basis of what we're talking about today. While all people are impacted by climate change, and some communities will be more affected by others, that also includes the Indigenous peoples across the country. So thank you.
Thank you very much, Eric. Now, Andy, how does this align with what you're doing at EPA with engaging vulnerable communities, knowing frequencies and magnitudes of disaster are constantly changing and evolving?
Thank you, Rhonda. We are certainly in agreement with what Eric and David have discussed. At EPA, we're continuing our work with people in vulnerable communities to understand the information they need so that they can make decisions that work for them. And this starts with them helping us understand where they are and their history as a community. Our research has developed a lot of data and a lot of understanding about how extreme events affect communities, how communities are vulnerable, and what steps they can take to reduce those vulnerabilities. But this doesn't help them unless we can turn that data into knowledge that's in the community. So there's a lot of work still to be done to translate the data into useful and usable knowledge for those affected communities. Among our efforts to do this, to support community-based decisions, is our work developing tools that provide those communities with the data they can access when they need it and how they need it. In the past several years, we've brought in staff with expertise in social science and public engagement to help us design and carry out our research so that it's focused from the first step on providing useful and usable information to those who need it. And these tools go beyond just providing information on impacts, like on floods or smoke from wildfires. Our Smoke Sense app, for example, lets users add their own information about how they're affected by wildfire smoke and what they're doing to avoid it, by staying inside, using masks, or even going to a different location. We've also developed processes that allow communities to work together to identify vulnerabilities, decide which ones are more likely to affect them, and which of those they need to address first. So there's a lot that goes into these tools: research to develop quality data, translating the data into knowledge, and the network of people needed to connect with users in the communities that have the greatest need. So thanks, Rhonda, for the opportunity.
Thank you, Andy. I'd now like to turn to what it takes to build the right public-private partnership network to deliver equitable solutions. When thinking unifying research to build resilience equity, what tools and solutions are available to build trust, strengthen planning and organization, and incentivize greater collaboration among government, industry, academia, foundations, and others? Jeff, we'd love to hear your thoughts on this now.
Sure. Thank you, Rhonda. Appreciate it. Well, it's a big job. First, it's important to recognize that the government is not always seen as the most trusted change agent. To foster trust, the government actually needs to listen and examine the way we engage with communities and to meet them, as they say, where they are. Building trust means confronting our biases, early and sustained engagement, and being accountable. NOAA and other agencies are working to understand how our services can be used to better serve communities that have been underserved to improve risk-informed decision-making. Agencies need to connect communities with the tools and services that strengthen their planning and organizational capacity and empower local expertise. That's why my office invests in locating staff in regions. Regional staff have a better sense of community leaders and partners who can help us develop and sustain trusted relationships with underserved groups. Overall, better decisions for equity are made when we understand what happens at the local level and why. Coordinated efforts across all levels of government, NGOs, the private sector, and local communities are key to advancing equity and leveraging investments in resilience. The exclusion of certain communities, often poor and communities of color, means that not all communities have a voice in efforts or benefit from programs. An approach for addressing these inequities is the Southeast and Caribbean Environmental Justice Community of Practice, launched last year by NOAA and partners, including the National Wildlife Federation and local leaders, to support regular conversations and collaborations in the region. The Community of Practice holds monthly meetings where participants discuss issues on the ground and together develop solutions. We can model and expand on this kind of approach by building new partnerships beyond our comfort zones, including with community-connected service organizations, social service and public health organizations, and organizations focused on environmental, social, and racial equity. There is an opportunity here to partner, to leverage more resources toward resilience goals, and to address first-order concerns such as affordable housing and job opportunities. The fact is that we can't be everywhere, nor do we have the expertise to build resilience in all the ways necessary for vibrant communities. The federal government needs to focus on empowering community-led efforts and involve interdisciplinary experts and trusted partners to amplify federal capabilities with understanding and equity at the forefront. Thank you.
Thank you, Jeff. And I think it goes without saying that I'm a big proponent of regional and local approaches. Very much appreciated. David Corman, would you also like to speak about P3s and how do you see that contributing to resiliency and equity?
Thank you, Rhonda. Yeah, I sure would like to talk about P3 and echo some of the sentiments of some of my other panelists. While NSF is known for much more for our longer term research, I want to tell you how we're having a direct impact on communities nationwide today. With partners from DHS and DOE, we launched the Civic Innovation Challenge program last year. It consisted of two tracks. Track A dealt with mobility, communities, and offering better mobility options to solve spatial mismatch between housing affordability and jobs. The second track, and certainly the most relevant to today's discussion on resilience, is resilience to natural disasters. How do we equip communities for greater preparedness and resilience? We've just completed the first stage of the program, which consisted of planning grants to 52 teams consisting of academic researchers and community stakeholders dealing with resilience and mobility and jobs. These are not your typical projects, which typically push research into communities. These are projects where the community is a partner and co-developing the project with the academic researchers, along with representatives from the federal government. Many of the projects are specifically targeted at resilience and mobility challenges faced by vulnerable communities, including some of those mentioned today: flooding, energy grid outages, food security, wildfires, and platforms for more equitable and responsive emergency management for the challenges that we expect to see today and in the future. Some examples of these are financial resilience through microinsurance and bonds. Disasters, we recognize, often have community impact beyond simply the time at which the disaster occurred. Those impacts last well beyond the flood, hurricane, and wildfire event. And this is a project that includes Charleston, South Carolina, with another project in New York City. We have a project dealing with communities in Fairbanks, Alaska, looking at low power sensor networks in cold climates. Innovation for economic rejuvenation in places like coastal Louisiana that suffer a constant series of hurricanes. Resilience, education, and training through AI teaming and drills, St. Louis, Missouri, Hennepin County, Minnesota, and Oregon, and resilience due to events such as floods and wildfires in Savannah, Georgia, Hialeah, Hawaii, New York City, Okawanga, New Mexico, and Calhoun County, Florida. We're now in the evaluation period for these proposals, for stage 2 proposals submitted by the teams. These are going to be for $1 million grants to implement the project in the community within 12 months. We're enthusiastic about the project ideas. We're enthusiastic about the impact on the communities, and we're doubly and triply enthusiastic that these are not just academic projects, they're projects in which communities, the academic researchers really share joint leadership and responsibility for execution, and not just execution within their communities, but execution with an idea to transferability of the ideas to other communities. Thank you, Rhonda.
Thank you very much, David. And I think our time is almost up, but I would love to have a lightning round and ask you one last brief question each. I'd like for you to speak about why research and development matters.
So my key takeaway on that question is that, federal agencies are becoming more imaginative and adaptive in their approaches. And I think you've heard that from all the panelists today. I think we're recognizing that we need to work with non-traditional partners and that our approaches need to be community driven, recognizing that they're living laboratories of innovation and that there's a significant role, value, and opportunity that diversity and inclusion bring towards solving some of the nation's most complex challenges. I think we've also echoed that the contributions that researchers tied to citizen scientists and other organizations, as well as underrepresented populations, can serve as catalysts for progress and engines for innovation. And that shift from that not invented here culture to that more cross-agency, cross-disciplinary, and cross-partner collaboration is here to stay, and that we're looking to accelerate and expand on those approaches.
Thank you very much, David. Andy?
Well, I'd like to follow up on that. I think one of the more important things that we've heard today is that research is not just in the lab. I think everybody should really focus on how invested we are in helping communities make decisions where they are. None of our technologies are going to work unless there are people in those communities who use them. And so the real breakthroughs in our research are not necessarily new flashy apps and technologies, but the people and the connections that build communities, trust, and capabilities where they are. And as we've heard, no one group has all the answers or can address all the problems. And that's okay, because ultimately we want the communities to know that they can turn to us to help them with the problems in those areas where we have expertise. And it's not to solve the problems for them, but to give them the resources they need to solve the problems in ways that are best for them.
Thanks, Andy. Jeff?
Sure. Yeah, thanks for the final opportunity. I actually work much more in the applications world, services delivery, that kind of thing, a little bit less in research, although that is really no, it's pedigree. It's a science agency, but with management responsibilities as well. And I guess one of the things that I take away is that that oft used term about interdisciplinary kind of solutions, that actually applies very directly here, because when we talk about resilient communities, I think that we need to include, for example, equitable development and health outcomes contrasted with or in addition to resilient ecosystems and infrastructure. All of those things have to come together. And I think the remarks today by other speakers actually affirm that. So this is what's needed for effective responses. And as we're doing this, you know, we really need to examine our policies and practices in the programs and to have a lens on equity and justice as we do this. It's got to be a change to our DNA, a change to our culture, the way that we actually inculcate this as a requirement from the very beginning. So social science, applications, those kinds of things can help us with understanding how to get there. And we just need to make it happen.
That's great. Thank you, Jeff. Eric?
Thank you. And within the CDC, we have the Climate and Health Program in our center. And we use the approach that we call the BRACE framework, which is building resilience against climate effects. And that is a hyper localized approach to looking at the threats within local communities. Often those are disparate between different parts of the community. And so these types of decisions need to be made with the full engagement of the community. But that is all based upon the evidence of what is there before them as to what the risks are related to climate change and disasters. And so that is all based upon the research that is developed and being able to inform the best practices. We want to be able to have evidence-based public health. The evidence is based upon the research that we're doing within our Centers for Disease Control and Prevention. Thank you.
Thank you, Eric. David?
First, thanks again for this opportunity. We're excited by the impacts that NSF research, and specifically our partnership in Civic, will have directly in the community. But this is only a start. Pandemics, floods, wildfires, and other disasters don't take a break and impact our most vulnerable communities. We at NSF and our partners realize that foundational research, when done properly, is not just good research, but when done in partnership with communities, can have lasting and tangible societal impact. Finally, an appeal. Bring us your new and creative ideas, and together with you, we can develop and implement new ideas that will bring about a safer, secure, and more resilient world as we face unprecedented challenges together.
Thank you, everyone. I wish we had more time. This was such a great and inspiring discussion. We now have a follow-up slide for you to learn more about community resilience and S&T's Whole of Government R&D Showcase program. On behalf of David Alexander at S&T DHS, David Corman at NSF, Eric Svensson at CDC, Jeff Payne at NOAA, and Andy Miller at EPA, I'm Rhonda Binda from the Queensborough President's Office. Thank you again for joining S&T's Whole of Government R&D Showcase.